All right, well, thank you to everyone who was able to find us, and I'm so sorry to anyone that will be watching this later, but I do really appreciate everyone that has, spent some time today to join us and be at our very first ever open house, and that it is virtual. So not exactly maybe how we kind of thought things would be going for our first ever open house, but we kind of have to just go with what the world gives us here. So some of you that are here may not know, but I'm Dr. Liz Andre. I'm the founder and one of the vets here with Sunset Vet Care. I'm really looking forward to talking to everyone tonight and letting you know a little bit about who we are as a service, what we offer, and as well as how you can kind of make an appointment with us. So the first thing that I'm going to try to do here is to share my screen, which I might already be doing here. So let me just pull this up here. All right. Well, at least the nice thing with Zoom is I know that how easy it is to screen share. So before we kind of get going today, I did want us to be able to take just a moment to pay tribute and remember all of our animal companions that are no longer with us. So if everyone could just join me in a brief moment of silence. Thank you so much for helping me recognize and honor these pets. So tonight clearly is not an overly formal event, but I do want to make sure that there's time for me to go over any questions that people may have, as well as to kind of go over things that were most frequently asked, and just kind of cover everything that might come up here. Before I start doing this, I just want to make sure I can see the chat if it comes up. Okay, perfect. All right. So please leave any questions in the chat. Nicole, I believe, is on here kind of taking some notes for me in case she sees anything come up and I miss it. So first off, I imagine that there's a few people here that are joining us because they're veterinary professionals in Winnipeg. And I think probably there's a few people here that are members of families that we've helped before. And I think as well, maybe some people that are interested in just what end-of-life care looks like. And I really appreciate everyone here that's joining us. So Sunset Vet Care is based in Winnipeg. We started offering our services in October of last year, and we've been growing ever since. I started Sunset Vet Care after just really dreaming of being able to create a house called Euthanasia service for very many years. I've always had a passion for helping people just as much as helping animals. And I think being able to help animals in their home is maybe one of the best ways to be able to keep both animals and people more comfortable and relaxed and be able to help them. And I feel like there's really no other better way for me to help. And I really find this type of veterinary work to be a calling, and I've felt very fortunate to be able to follow my dream. So a little bit about me. So double get to see me on video maybe as well as my screen here. So I'm a veterinarian. I'm a wife, as some people might have heard me yammering at my husband, hoping that he could help me a little bit here at the live video. I also am a mom of a 2-year-old little boy, and I'm a dog mom with 3 dogs. So I've got Jack, Rigby, and Hot Rod. And you will definitely see them throughout our website. They're in all sorts of photos, and they definitely kind of get to be featured. I did have a kitty named Tiger, and she was a big inspiration for me to start my journey into my training for end-of-life care. She passed away in October of 2017, and a few months after her passing, I started on my journey of becoming certified in animal hospice and palliative care through the International Association for Animal Hospice and Palliative Care. I've been in the Winnipeg vet community for just shy of 15 years now. So next up we have Nicole, our care coordinator, and Nicole is really and truly our backbone at Sunset Vet Care, just as far as all of our day-to-day functioning. She's going to be your first point of contact whenever you reach out to us. Nicole is here in Winnipeg and shares her home with her husband, her son, her dog Chewy, and her kitties Butters and Draco. Nicole has just such an excellent sense of humor, and she really enjoys spending her free time quilting, walking with Chewy, and camping with her family. Next, here we have Dr. Rita Mckay, pictured with her grand dog Milo. I've had the pleasure of working with Dr. Rita for most of my years in the veterinary world, if not all of them really at this point. And Dr. Rita is so incredibly compassionate and truly just one of the kindest people that I know. She's always had a soft spot for her senior animals, and I'm really very thankful that she's part of our team. Her special interests are in all things beyond conventional veterinary medicine. So she's certified in veterinary acupuncture, animal spinal manipulation, and canine rehab therapy. She dedicates most of her professional time working in a local clinic providing these additional services. And then in her spare time, she is outdoors, either skiing, canoeing, hiking, biking, gardening, or she's indoors creating pottery, stained glass, and paintings. And newest to our team is Dr. Natasha Zlody, or Dr. Nash. She is gentle and empathetic, and she just has a very calming energy, which I think is very important for both animals and their families. She's always found it important to recognize the importance of end-of-life care, and not only for our patients, but the importance for their caregivers too. So currently, Dr. Nash splits her time between Sunset Vet Care and a local general vet practice. She spends her spare time with her partner and her two dogs, Addie and Herschel, as well as spending time at the barn with her horsey friend, Buddy. So just a note to let you know that all of our veterinarians, including myself, have completed the master program from the Companion Animal Euthanasia Training Academy. This program is designed for veterinarians who are looking to advance their understanding of death and death-related topics, as well as various techniques, and it emphasizes stress and pain-free passings for pets. Yes, this is our team. So briefly, I want to let you know what we offer as far as our services. We are predominantly a euthanasia service. Oh no. Am I still on mute, Nicole? Sorry, I just saw your message. I've been just yammering this whole time to nobody. Okay, good. Oh, geez. Okay, so yeah, so I just wanted to cover our messages. Thank you, everybody. Just let you know a little bit about what to expect. So we are predominantly a euthanasia service, but we do offer some other services aimed towards companion animals to better their end-of-life experience. So a couple of important things to know. We offer all of our services in the comfort of your home. We expect families to abide by current public health orders regarding who is present in their home, and we do require everyone who is present to wear a mask or face covering. We currently provide care to cats and dogs, but if anyone happens to have a different species of pet, please reach out and we can discuss possible options. So as I had just, and just something I had noted here, that all of our fees are listed on our website. So I did mention earlier that we are predominantly a euthanasia service. So the word euthanasia itself literally means good death. And euthanasia is the process of assisting in the death of an animal in a compassionate and gentle manner. And at Sunset Vet Care, providing good, gentle passings is what's most important to us. And being at home and the use of medications really helps us to achieve this passing. So I want to just take a couple minutes to walk through what a typical appointment would look like. And then we'll kind of backtrack a little bit afterwards and talk about how to schedule and everything like that. So on the day of the appointment, when a vet is on their way to your home, they will send a text message with an expected time of arrival. Our appointments do have a 30-minute window to accommodate if there's any traffic or unexpected delays. But there will be some notifications so you know when to expect them. When we do arrive, I'll typically give a quick call just to let the family know that I have arrived, and then I'll enter their home with my supplies. Myself or the other veterinarians, we spend some time talking with the family, greeting the pet, and just making sure everyone is comfortable as possible. There's of course some paperwork that we need to go through before we proceed with the remainder of the appointment. But throughout this time, we try our best to not move pets from where they are resting. If there, for whatever reason, is somewhere else that we would like the pet to go and it's difficult for them to move, sometimes we'll just wait until they're more comfortable after some sedation to do so. So during our visits, we're going to have two phases. Our first phase is going to be for the sedation, and our second phase is going to be the euthanasia medication. During our sedation phase, we administer some medication that contains pain relief and sedatives, and this allows for the animal to relax and drift to a comfortable sleep before we proceed with the second stage. On occasion, sometimes we require multiple medication steps during this stage. Typically, most pets are quite comfortable with receiving this medication, which we do have to give by needle just under the skin. But for whatever reason, if families were unsure how their pet would do in such a situation, we do really appreciate having a heads up ahead of time so that we can make sure that we make the visit as stress-free as possible and just adapt our plan as needed. Once the pet is comfortable and sleeping, so this will take a few minutes after getting the medication. We're going to be checking to make sure that they are comfortable by doing things like gentle touch of the face and at the paws, and just ensuring that this doesn't cause any sort of reaction. Once they are comfortable, we're going to take that opportunity to make a paw print memorial and collect any fur samples that a family may want. If you are able to see me on video, I know it might be a little small right now, but I'm just going to show you what we offer. So what we use is something called Paw Pal, and this is what the complete item looks like. That once it's opened, you can see the paw print, and this would be a place where a photo could go. I find that this gives a very simple, low mess, and long-lasting way to keep a paw print for families. So after we've completed our paw print and our animal companion is more relaxed, what we then proceed with is the euthanasia medication. So this euthanasia medication is going to deepen their sleep before it slows down and then stops any breathing and the heart. Typically, passing occurs within about 5 minutes, but we're here to support them with whatever this time looks like. We do our best to allow the passing to be in their favorite spot, whether that's on a bed, a couch, on laps. We're going to be able to make sure that they're comfortable. So after a pet has passed, some families choose to arrange their own aftercare. For these families, we stay with them briefly to be present for any questions they may have before we then leave. For families that are having Sunset Vet Care arrange their pets aftercare, we do step out and allow them to have some privacy before coming back in. Once we do come back in, we enter with a stretcher with a lot of comfortable blankets or a basket filled with blankets, just depending on the pet size. And we do require a family member to assist with lifting one side of the stretcher, but we can arrange for assistance before the appointment if there's not someone that is able to do so. In a little bit, I'll just go over the different aftercare options. So we do also offer quality of life assessments. These assessments are designed for our vet to spend about an hour with the family to give them a sense of their companion's condition and kind of expected trajectory of the illness or expected illness, and just to be there to help with making difficult decisions. So each pet receives a checkup, and then we spend a significant amount of time kind of going over what pain looks like, how we're going to assess quality of life, and also being able to make a plan for your pet. And then depending on the decisions made, sometimes we proceed with euthanasia the same day if time allows, or we may make a plan or send some prescriptions into their regular vet. And then at the end of that appointment, a summary will be emailed with some worksheets. We do also have a small hospice and palliative care program that currently is by referral only. So hospice and palliative care is designed to promote quality of life with patients nearing the ends of their lives. We spend time making sure families feel empowered in the decisions they're making. So this initial visit is going to be very similar to a quality of life assessment, but it does include a bit more, such as like an environmental assessment, so we can check out the home and just give any tips that might help there. And then we do send a much more detailed plan after the visit, and then arrange for ongoing care and assessments going forward. If this is something that anyone is interested in, we do encourage you to reach out to us or to discuss with your vet. Okay, so currently our phone hours are from 9 to 3:30 Monday through Friday. And if you call during this time, Nicole will answer your call, or she will get back to you shortly if she's helping another family. We accept emails and texts as well. Our appointment times are typically during the day, Monday through Friday, but some evenings or weekend times may be available. So please check in with us when you're looking for a time. For visits within the city, our appointment fees include the house call or travel fee. So for visits just out the city, we do have an additional $50 travel fee. So have an image here where you can kind of see a bit of our travel area. In the green is what we're considering kind of the city limits, and then the blue is just outside of the city. This map is on our website and our contact us kind of area there. So when you feel ready to kind of reach out and schedule an appointment, there's a few different ways that you can do so. The easiest way is going to be to give us a call. So you can reach us at 204-813-8908. And this number is also textable, or you can email us. But ultimately, anyone that's contacting us with a non-call communication will be guided to our website to fill out an appointment request form. So I just wanted to show you what you'd be looking for here. So on our website, you can see kind of our contact information. There's a general contact form if you just have some questions. But if you are looking to request an appointment, we just ask that you select this request an appointment button. Here you can fill out information about yourself as well as your pet and your wishes. So the information on this form is very important for us to have, and we do request you fill out as much as possible. Nicole will follow up within a few hours if it's during a normal business day, but if we're closed or if it's after hours, you can expect follow-up in the next day that we're open. And once an appointment time has been confirmed, you will receive an email confirmation that contains lots of important information about the appointment itself and our protocols. And then a second email comes through that contains an invoice, and that invoice can be paid ahead of time with credit card or e-transfer, or in person. We accept cash, debit, or credit cards. Okay, so I also wanted to just take a moment to kind of briefly go over a few things we can do to prepare ourselves and our pets before an end of life home visit. So my biggest recommendation is going to be to plan ahead. So I know it's never easy to make this decision, but having to make the decision in an emergency situation can really add to the stress. And I think having some time to consider of all your options, such as, do you want to be at home? Who do you want to have there with you? What type of aftercare option would you like? Just having this time really allows for you to make the decisions that you want. On the same note, it's really important to talk about how you're feeling and kind of talk to trusted family and friends about what's going on, or even reaching out to your veterinary team that can help to guide you to understand what's going to happen or what's to come. I do think it's really important as well, leading up to the appointment, to get to spend some quality time with your friend, whether that's going to be a bucket list of items that you need to get through or just having some really good snuggles. You need to just do what's going to be best for everyone involved. Before the appointment time, though, I do recommend making a comfortable space for yourself and for your pet with different or more familiar items or smells. So if there's any treats that they like, or stuffed animals or bedding, that's a good idea to include those things. I've just added on the bottom here the information for our blog, and then I don't know, Nicole, if I could ask you, maybe you could pop it in the chat, that blog post, just to be able to, if anyone wants to check for that. But you can also find it on our website pretty easily as sunsetvetcare.ca. Click on the blog and it's going to be one of those first ones there. Okay, and just to cover our aftercare options. So when I say aftercare, what I mean is what happens to your pet's body after they pass. So some families choose to keep their pets close to home, whether it's a burial at their home or on some property such as at the lake or similar. In the city of Winnipeg, as well as most of our surrounding RMs, this is legal to do so. Because a relatively deep hole needs to be dug, so at least 4 feet, we do recommend that contacting Manitoba Hydro's call before you dig. It is kind of an important step here, just to make sure that no important cables or whatnot are hit while digging an appropriate resting spot. For families that are looking to have their pets cremated, so this is, of course, the process of turning pets into ash remains. We have a few different options available to us. So I think the first thing to really consider is whether you're looking to have private or communal cremation. So private cremation is going to be for families that are looking to have their pets' ashes returned to them. And then pets will be cremated individually and their ashes will be returned to their family. And if families are not looking to have their pets' ashes returned, then we'll be looking for communal cremation, which is when multiple pets are cremated together and their ashes are communally spread on land that's cared for by the crematorium. So once this decision has been made, the next choice is going to be to determine what type of cremation you would like. So we handle our traditional or flame-based cremations. Sorry about that. We handle our traditional or flame-based cremation through Precious Pet Cremation in Winnipeg. And then for families that are looking for alternatives, we have Peaceful Pasture Pet Cremation in Lactobani, and they offer water-based cremation, or otherwise known as aquamation. So both services are wonderful, and we are fortunate to work with both of them. Both have beautiful urn options, or you can just have ash remains returned to you in a spreading box if you're choosing to spread ashes or to use your own vessel. Typically, we expect families to receive their loved one's ashes within about a week's time, but we can arrange for pickup directly from the crematory, pickup through your regular vet, or we can arrange delivery to your home within the city limits through Citywide Fetch. Okay, after a few bumps here, we made it to the end of kind of our more formal part of our presentation. So I'd appreciate it if there's any questions that you can leave them in the chat. I think if you'd like, you can ask to have your video started if you wanted to be brave and ask a question on video. But I do really appreciate that everyone's been able to join us here today. And of course, if for whatever reason we don't get to your question or you don't feel comfortable asking in a public setting, please reach out to us through email, info@sunsetvetcare.ca, or you can give us a call at 204-813-8908. Thank you so much, Gail. I really appreciate it. I'm just going to type out our contact information. Okay, so question from Michelle. So as far as offering prescription for pain relief prior to end of life service, this, as far as getting any sort of prescription, that we do have to have a valid client-patient relationship with the veterinarian per our bylaws. So this would require a vet to come in and assess your pet beforehand. If for whatever reason, that wasn't something that someone was looking for a quality of life assessment first, certainly reach out to your regular vet. As right now, we do not have a pharmacy ourselves, so we do currently write prescriptions for those pets that are getting assessments from us. Yeah, I think, Michelle, if you're feeling that your own dog is, maybe looking to have some comfort added in, but you're not quite thinking that it's, end of life at kind of situation at this point, it might be a good discussion with your regular vet. And then something that I'll just give a plug for my good friend, Dr. Amber Lee, as far as families looking for house call services that are not just for end of life care. We have Prairie Lee Mobile Vet is available for general house call. I'll just add her info. Okay, let me just, I see a couple questions. I just want to make sure I get everybody. The next question is, Gail's just asking about Dr. Rita's alternate therapy. So Dr. Rita currently is offering her other services out of Transcona Vet. And I have another question about needing a patient's medical history before seeing them. So we do not require a patient's medical history before a euthanasia appointment. Our vets do perform kind of a brief evaluation. Just, you know, it's not going to be a thorough exam like if we were in a clinic setting, but excuse me, between looking at the pet that's in front of us, as well as our discussion to make the decision that it's the right choice. If for whatever reason we felt that it was not an appropriate decision, then that would definitely be a new discussion. But any families that are looking for our quality of life assessments or our hospice and palliative care, we do appreciate having a medical history sent to us from their regular vet beforehand. But it's not required, but just does just help us get a better idea of what's already been done as far as any testing or therapies. Awesome. Well, I'm really, really thankful that everyone was able to join us and not kind of bear with me while we figured a few things out here, but perfect. Well, thank you so much, everyone, for joining us tonight. Even though the live didn't work on Facebook, I believe that event page should still be there, that you can certainly ask questions there. As well, you can scroll up a little bit in the chat and find any of our contact information to be able to reach out. Perfect. Well, we'll end on this really cute picture of all of my wonderful little doggies here. And in case it wasn't obvious, this one is Hot Rod. We've got Rigby and Jack, and they are all considered seniors at this time, although only my big guy Jack is kind of showing it these days. So wonderful. Well, thanks again, everyone, so much. And thank you so much for your wonderful comments and questions. It's really helpful to get an idea of what people find helpful. Okay, have a great night, everybody. And hope to hear from you with anything that might come up.